anybody in this room not familiar with hyperbaric oxygen therapy? Never heard of it? You're living under a rock? No, good. All right, I love it. I love that everybody in this room already knows everything, so I can skip the first half of what we're talking about. Guys, we will give you some of the mechanisms, talking about how hyperbaric really works, the mechanisms in the brain versus other parts of the body. It's important to understand, so let's just kind of dive into it as everybody's coming in here. Guys, a little bit of disclosures here, the type of disclosures we have to share. As far as learning objectives, understanding the mechanisms of oxygen under pressure, how that affects neuroplasticity, recognizing clinical evidence supporting hyperbaric oxygen therapy and neurocognitive health, and then really how to apply these principles. And then guys, by the end, I will be providing the protocols that we use in our clinics, the protocols that are backed by the International Board of Undersea Medicine, and some of the wider protocols that are starting to be better understood. If anybody was just in Lecture Hall C, we just heard somebody speak all about hyperbaric there as well. We're gonna be covering actually a lot of the same research. I'm not gonna dive into all the numbers on that research. All of it's available to you guys here. But so why are we talking about cognitive decline and hyperbaric? Well, the reality is that the prevalence of cognitive decline is really, it's increasing significantly. 2013, about 5.3% of our aging population. Now we're up to 7.4% as 2023. Those percentages don't sound a whole like a lot of people until you recognize that, well, 5%, 16 million people, and now we're talking about 24 million people affected by cognitive decline. But I'm not telling you that 24 million people in our country have Alzheimer's, or that they have vascular dementia or Lewy body dementia. We recognize that cognitive impairment, it can come from other chronic diseases. In fact, more than 50% of cognitive decline is associated with chronic diseases like hypertension, cholesterol. I mean, if we're choking off that blood flow to the brain, we're choking off the oxygen, and therefore we're not gonna have the same functions. We can go through a number of these other diagnoses, but recognizing that cognitive decline associated with Alzheimer's, with other misfoldings or otherwise that we're talking about really are only part of the picture. So we need to change that focus. Our focus should really be that we treat cognitive decline by preventing chronic disease. This is outside of hyperbaric. Yeah, hyperbaric plays a role, but if you're not out there being active, if you're out there eating a poor diet, if you are not prioritizing your sleep, the results won't be the same for you, but you'll also see that cognitive decline much sooner. So there's other things here that we talk about. Yes, mitochondrial function. Yes, you can pick up all sorts of supplements for that, or you can have more muscle mass, which means you have more mitochondrial density, which is like having more engines in your vehicle to make more of what you need to tell your cells to talk to each other, to have every bit of ion exchange that we need ATP for. So guys, hyperbaric oxygen therapy is a piece of the puzzle, and that's what we're here to learn about, but I don't want you to leave here saying, I'm just gonna throw every chamber in HBOT, we're gonna wake up their brain, everything's gonna work the way it should. No, you can't outrun the fork, and if your patient's sedentary, diabetic, having a number of other concerns in their health, they're not gonna get the same results. My patients who get the best results are my athletes. They're not built like we are. Their mitochondrial density and their ability to use oxygen is significantly better. We might modify our protocol based off that patient's muscle mass. So, oxygen in the aging brain. Before we discuss adding even pressure and everything to do with hyperbaric, let's recognize that you need oxygen for energy production. Yeah, I can make some ATP without oxygen. Not much. Not enough to live, right? Yes, neurotransmitter synthesis. However, there's a reason that everybody gets out of a hyperbaric chamber and says, I just feel better, and they can't quantify that feeling. I feel better. I just feel good. Guys, neurotransmitters, talk about serotonin and that effect. And that's, again, by adding pressure, we have that effect. And then cognitive function. We recognize if we're desaturating all night, we're have sleep apnea or otherwise, that we're gonna have other cognitive decline that's very concerning that we need to talk about. So I think it's important to recognize that oxygen, without diving into the chamber and everything else we're about to talk about, plays an essential role. So guys, what is hyperbaric oxygen therapy? Before everybody else started walking in this room, everybody here said they were experts. I don't know if you guys caught that walking in, but guys, it's actually pretty simple. It's oxygen plus pressure. There's nothing really about hyperbaric that's more than adding pressure plus the partial pressure of oxygen. Now, in 2024, UHMS did say we need a new definition of hyperbaric oxygen therapy. It can't just be oxygen plus pressure, because that's too open. They said it has to be above 2.0 PO2 or 2.0 ATA, which means 100% oxygen, and that's the fraction of inspired oxygen. That's not a nasal cannula with 40% FiO2 at 2 atmospheres. That's not going to give the same effect. We're talking about a bib system, a mask, and we'll talk about those in safety later as well. However, I don't agree with UHMS. If we add pressure and we have high concentrations of oxygen, there's going to be a net effect. And a lot of research has shown this. We'll dive into that. But why does that pressure matter? Why is it different than just breathing oxygen sitting right here, right now? Well, guys, you're carrying about as much oxygen as you can. Your red blood cells, your hemoglobin, carries roughly 19 milliliters of oxygen per 100 milliliters of whole blood. And if I give you 100% oxygen, great, I take you up to 20 milliliters. You guys are saturated. That's what that means. And if I throw you into a chamber at 100% oxygen, at the highest pressure I can treat you at 3.0, your hemoglobin's only going to carry 20 milliliters of oxygen. It can't carry more. Yeah, maybe go do what Lance Armstrong did and get some more red blood cells. However, you're never going to carry more oxygen on that hemoglobin. And the other part of that to recognize is that the majority of that oxygen on your hemoglobin, on your red blood cells, it's kind of bound tightly. Your red blood cells don't really love to give up all that oxygen. That first molecule, yeah, pretty easy to give up and pop back and forth. That second molecule, we're talking about you're hitting your runner's high, you're getting to that point where you really need to extract more oxygen. Those last 2 molecules, you are not pulling them off that hemoglobin no matter what, until you're on your deathbed. So why is it so important that we talk about the next step here of it being plasma concentration? Plasma concentration is where we dissolve the oxygen into the liquid component of your body. You've heard this before, you're made of water. Well, that water is primarily your plasma, and plasma can increase exponentially. The plasma that we're talking about driving all this oxygen to, we can get up to 6.8 milliliters of oxygen per 100 milliliters of whole blood on that plasma. It's not bound, it's freely usable, it's available. So it's so much oxygen that you might not need red blood cells. Yes, I know that you're falling asleep back there and you're like, did doc say I don't need blood? If you lived in a hyperbaric chamber at 3 atmospheres with 100% oxygen, it is correct that you do not need your red blood cells to support your tissue at rest. This was proven in 1960 by Dr. Ita. He said, let's take all the blood out of these pigs, replace it with a crystalline solution, throw them in the chamber and see what happens. And they lived. And then they, ended up putting all the blood back in 45 minutes later, no negative consequences that we knew of at that point. It's how we recognize that there's situations where if I can't get blood flow there, by saturating the plasma with oxygen, I can support that tissue. Now, I practice in Arizona, in Scottsdale, Arizona, and we've got a lot of plastic surgery there. So we see a lot of filler-induced necrosis. You block a blood vessel with that filler, and all of a sudden red blood cells can't get the oxygen there, but I can get it there on plasma, and we save that tissue. So think about next time you get in that filler, that you better know where that center is that can hop into a chamber. Or if you do filler yourself for your patients, it's good to have a chamber or somebody that can take care of your patients. So let's look a little bit more at the peer-reviewed mechanisms here as we talk about hyperbaric oxygen therapy. Obviously, it's elevated tissue oxygen, dissolving that oxygen. That's simple, it's straightforward. Some of the ones that are really important that we don't discuss specifically here about cognitive effect and enhancing, well, we can talk about reducing lipid peroxidation. We're talking about inflammation there, or we talk about Somebody drink out of that one. We can also talk about reducing leukocyte adherence. I want my white blood cells to get out of the vessel to get to the site of injury to do its job. And if it's inside the blood vessel, it's going to have a pro-inflammatory effect. The net effect is now other things are getting stuck there inside the blood vessel, more accumulation of plaques or otherwise. Vasoconstriction, guys, oxygen's a vasoconstrictor. Your blood pressure goes up in the chamber. No, I got a whole stack of them, thank you. Oxygen goes up inside, the constriction goes up, your blood pressure goes up in the chamber. And patients are like, well, no, I have high blood pressure. I don't want my blood pressure to go up. Well, if you exercise, blood pressure goes up. If I put you on normal baric oxygen, blood pressure goes up a small amount. We're talking about 7 to 10 millimeters of mercury. Improving that microcirculation, there's many places where we have relatively hypoxic zones or chronically hypoxic zones. We have amazing results in this tissue. As we talk about reactive to oxygen species, you might have just heard in the last lecture talking about hyperbaric that we increase your free radical scavengers. They stay elevated longer than the reactive oxygen species. But I think what was missed in that conversation, we've got a short time, it's not that he missed it, he just couldn't add everything, is that reactive oxygen species do cause damage, but they're also messenger molecules. They're very important for recruiting cells for healing. I want to increase the free radicals as long as I also increase the free radical scavengers, and that leads in the conversation of frequency of treatment. And if you guys want the short and simple of frequency of treatment, it's daily. All published data, it's daily. Yes, we could do less frequent treatment, probably have results, but for published data, it's every day. All right, so guys, a little bit deeper into the mechanisms here. Well, we talk about mitochondrial function, upregulating your mitochondria, and the great news here is that it stays upregulated when we're done. When you finish hyperbaric oxygen therapy, you've created genomic change. You're forever going to handle oxygen better. Stem cell mobilization, this does play a role in the brain, but it plays a role in every tissue. We want you to recognize that we can mobilize stem cells 800%. And these are the CD34 positive mesenchymal stem cells, the stem cells you want. It just takes 20 consecutive treatments at 2.0 with 100% oxygen. The immune function and some of these other collagen aspects we can talk about, there's a lot. Let's talk a little more about the brain. These mechanisms here are all peer-reviewed, proven mechanisms of what we stimulate and what we inhibit or downregulate. The neuroprotective aspects, we're going to dive pretty deep into that and why it's so important that you start treating now. I don't want somebody to come to me with severe cognitive decline, say, let's flip the switch, let's see what happens. No, let's start protecting our brain now. And you already heard me say this before, you're going to start protecting your brain today by being more physically active and eating better. It's the two things that I would recommend way beyond doing hyperbaric. So if you're doing those, now we dive in the chamber and really protect. The neuroinflammatory side, guys, neuroinflammation is extremely interesting, the pathways we can talk about here. But what's really interesting is what we affect, the patients that we affect by treating neuroinflammation. When I first bought the clinics that I now own, we were treating a lot of autism. And I don't come from that side of medicine. I come from wound care, surgery, other side that we were doing only really high pressure treatment. And when somebody told me we're going to treat children with autism and to create change, I was like, oh my gosh, I don't know about that. Turns out I didn't know anything about autism. I didn't realize that it is a neuroinflammatory disease and that the vast majority of those diagnosed with autism have hypoperfusion to the prefrontal cortexes. Well, if I don't have enough oxygen getting there and it's inflammatory, I'm saying, hey, it's reasonable that we could have an effect. And we've had so many first words spoken in our clinics. It's amazing to see now. The oxidative stress sides we'll get deeper into, the angiogenesis, mitochondrial upregulation, neurogenesis. It's a word I pushed back on for a while. I don't know if your education told you that if you damage the central nervous system, there is no fixing it. We heard that peripheral nerves can grow back, but central nervous system doesn't. And so much research has challenged that recently. So as we talk about neurogenesis, we can also talk about density in some of these tissues, dendritic tissue density. And then the last part is apoptosis, programmed cell death. I want my old cells to get out of the way so a young cell can come and take over and do its job. So this is talking about the senescent cells that Doc was talking about just an hour ago. Some amazing stuff there. So let's talk about the neuro research. Everything that's here, you're going to see I've cited all the research. When you get the presentations, if you want more, reach out, and my contact information's all over this. So the first study we're going to talk about, in healthy older adults, we found that HBOT improved attention, processing speeds, executive function, and regional cerebral blood flow changes. We didn't see a global change in blood flow everywhere. In fact, remember, oxygen is a vasoconstrictor. We might decrease blood flow, but we're still able to increase the oxygen to these tissues. We can talk about post-stroke. Post-stroke is where we see some of the best results. We're going to split that into hemorrhagic and ischemic strokes, showing you the difference there. Mild cognitive impairment. Guys, we treat a lot of mild cognitive impairment, and it's amazing the results that we see. We work hand in hand with the Amen clinics in Arizona, and they send us patients, and they tell us, we need to follow this protocol. And I say, great, you guys really did the research because you have a great protocol, and you're going to do imaging to tell me if we're doing the right thing for your patients or not. And overall, we've had just a fantastic relationship because they can give me the quantifiable data that we have a hard time doing in our facilities. Amen clinics, Dr. Amen. Yep. Talk about SPECT imaging. We'll actually look over some of those. We talked about late neuroplasticity activation. Late stage neuroplasticity after a stroke is fantastic. We've had patients come to us a decade after a stroke regaining function. Now, when somebody comes to us, I don't say, I expect we're going to get you all the way back to normal. Absolutely not. I expect a change. All right, so age, brain, preclinical models, and real-world neuropsychiatric outcomes. So let's take a look at one of these studies. This is with healthy older adults, and I love quoting studies here. We found HBOT can induce significant enhancements in cognitive performance in healthy elderly. The main improved domains include attention, information processing, speed, and executive function, in addition to just global cognitive functions. So how are they doing this study? This study didn't only do the mini mental status exam or the MOCA. Those can be effective and they can be helpful. However, they looked at different Brodmann areas of the brain, specifically Brodmann area 10, the superior medial frontal gyrus. It's thought to contribute to that higher cognitive function, and through SPECT imaging, watching the brain metabolism, we were able to see that these areas had an increased metabolism post-HBOT. Brodmann area 6 participates in memory, attention, executive function. Brodmann area 8, that superior frontal gyrus, and these studies showing that it has executive functioning, reasoning, planning, memory, and attention. All these areas were upregulated by seeing SPECT imaging. So here's another one for post-stroke patients. If you were sitting through that recent, the last lecture on hyperbaric, he mentioned specifically this study, and this is from Dr. Afradi, talking about late-stage neuroplasticity or similar studies. On these studies, we always find a benefit. And as we split these strokes into the different types of strokes that we're talking about, in the darker color here, we have hemorrhagic, a brain bleed, and in the lighter color, we have ischemic strokes. Every one of these is the mean absolute change after doing hyperbaric. So every single patient in this, 86% showed clinical significant improvements, 100% showed a change that was positive in this study. So looking at the global cognitive scale, looking at executive function, look at attention. It is absolutely fantastic. Now, our hemorrhagic stroke responded better than our ischemic stroke here. And if we look at motor skills, our ischemic strokes had much better benefit for that. However, I do tend to find my patients with ischemic strokes have more motor issues than my patients with hemorrhagic strokes. That kind of throws that for a little bit of a loop on that research. Another study here is the 11 randomized controls recruiting 847 patients here. The summary on this meta-analysis provides that some evidence that hyperbaric oxygen has remarkable benefits improving the mini mental status exam, the Alzheimer's disease assessment scale, the activities of daily life, and this is specifically in patients with Alzheimer's disease. And we treat a ton of patients coming through the door with Alzheimer's now. But I got to tell you that my patients with vascular dementia have got to be my favorite because it was a blood flow issue. And if we increase oxygen to these areas of the brain, they wake up quickly. The results are fantastic. Kind of even like a patient who had a stroke, the area around the stroked tissue is where I'm going to see the change in first, the penumbra. The penumbra has not gone through liquefactive necrosis. It's an area of hypometabolism. And if we're able to wake that metabolism up, see cell turnover and change, we see fast results initially for that stroke, and then a period of time that we see very little change, and then typically somewhere between 30, 40, 60 treatments is where we see more change. And sometimes it's even after we finish treatment that I hear on our follow-up that how much change they notice in the time off. So in this study that we're talking about, this meta-analysis, they found the mini mental status exam score before and after treatment. It was significantly improved at 1 month follow-up and at 3 months as well, compared to the control group. Same with MoCA. So let's look what that looks like in graph form. Sorry, I know I'm clicking through kind of quick here. We don't have a ton of time. So the mini mental status exam, you'll see it's the group in the darker black, they had a benefit and then it slowly tapered off. We are not curing, a neurodegenerative disorder. We're not curing anything with hyperbaric. It gives your body a foundation, So yes, it is absolutely true here that at 6 months, they still declined, to worse where they were when they started, and possibly based on this one. On the MoCA, they declined, but you see on the MoCA, they declined less than they would be without treatment. So yes, they still declined. I recognize we are all going to decline as we age. This is the reality of the situation. I want to slow that decline as much as possible. So this image here is to give you an idea of what we're looking for as opposed to an actual number or study there. So guys, in healthy populations, we have extremely limited studies. We just do. The vast majority of hyperbaric research is done on carbon monoxide, on wound care, on diving. Yes, we're seeing it with radiation, and the newest approved indication is now avascular necrosis of the femoral head, of the hip. And I wish they just said, let's stop at avascular necrosis, right? Because if we stop there, I recognize I get the same effect in every tissue, whether I'm talking about the hip or let's talk about the scaphoid. Who here has that scar on their radius right here from falling on an outstretched hand? But they're saying, no, it's going to work in the hip, it's not going to work in the scaphoid. Guys, we just have to recognize that we don't have enough research to recognize how many benefits there really are. Now, the conclusion on this healthy population was pretty straightforward, and it shows cognitive change. In the HBOT group, there's a benefit. Aerobic fitness change, a benefit. Look at the benefit for energy. Think about our aging population trying to protect their brain. I'm telling you need to go exercise, you need to be active, and they're like, I have no energy. Great, I'm gonna help build that aspect. Post-training recovery and just general satisfaction. So guys, as we get here towards the end, I pulled those same mechanisms back up. Every one of these is peer-reviewed, published studies with hundreds, if not thousands of studies. So as we look at mechanisms again, this is from the Segal School of Neuroscience out of Israel. Mentioned that HBOT has a multifaceted neuroprotective effect on the brain that involves the immune, neuronal, and vascular systems, leading to enhancement and recovery of cognitive performance. So let's talk about protocols. That was supposed to be a video. It looks really odd the way he's just standing there. There's little consensus on protocols. You're going to hear this from just about everybody in hyperbarics. And the reality is that there kind of are no protocols because every patient needs a tailored approach. However, most of the studies that I just cited were doing 2.0 ATA with 100% oxygen, so that means 2.0 PO2, for 60 to 90 minutes, 5 to 7 days a week for 40 to 60 sessions. Typical clinical protocols tend to be at lower pressure than that, and that will probably even advance more with lower pressure than what you're going to see here. This was put together by a number of clinics that we work with and have seen on research. And 1.75 to 2.0, however, you'll probably recognize that a lot of facilities will probably say, maybe 1.5 to 1.75, possibly 2.0. I like 2.0 for the stem cell aspect, which is important for what we talk about. And then you can see other centers saying, we found the research at 1.3, 1.4, 1.45. The reality is that we need more research to recognize what is the best. Now, mild hyperbarics, guys, this says here not based on research. I'd say it's not based on enough current research. I'm going to tell you that anecdotally, a lot of centers have patients getting a lot of benefit at lower pressure. My recommendation is starting people at lower pressure. If I can use the minimum effective dosage of any drug, I'm going to. And that should be the goal for all of our patients. Guys, I'm going to digress for 1 second here. We're going to talk about safety in hyperbarics because it's so important. Guys, if you're getting into a chamber, make sure it's an approved safe chamber. If you're prescribing hyperbarics for your patients, it better be a chamber that's gone through the American Society of Mechanical Engineers and pressurized vessels for human occupancy. The chambers you see here are fancy looking chambers. Fancy chambers are not what medical hyperbarics looks like. These chambers have very unique aspects, but they're just not safe enough for us to use for patients. You know, it's a major concern that I have. So approved chambers, anytime you look at a chamber, look for the chamber stamp. It better be stamped with PVHO, it better be stamped with ASME's mark. Otherwise, don't get in it, don't recommend it for your patients. So guys, I appreciate everybody coming out and listening to what I had to say here about the brain. Again, I don't have time for questions, but if you do have questions, reach out. This is my cell phone number. You'll get right to me. You know, Instagram's here as well. The website, rx-o2.com. Guys, it's O as in oxygen. It's not a zero. And then my personal email is my name, Dr. Borsand at rx-o2.com. However, you could send that to rx-02.com. I will get those now. I don't know if they gave me somebody else to introduce. No, I guess I'm good. Oh, yeah. All right. So, guys, thank you so much for coming by.
Fantastic.